Well, hi, everybody. Thank you for coming today. And we're excited to share some information with you regarding Ally Health. Again, my name is Mary Kuhn, and I am with Benefits by Qnity. Benefits by Qnity is a division of Qnity, which was created roughly a year ago following Qnity's completion of a large-scale compensation study that involved 330 salon locations. A key finding in the area of employee benefits that they discovered was that there's a huge need and desire for mental health benefits, but with few companies actually offering any solutions. So as a board certified health and wellness coach with over 5,000 coaching hours, when I was coaching, which was up until last December, I personally saw the need for mental health counseling truly skyrocket, of course, during the pandemic, but it persisted even post-pandemic. And I also witnessed my clients' struggles to access needed, affordable, and timely mental health services. Ally Health is a virtual care platform offering mental health counseling, telemedicine, as well as other services. And based upon my coaching experience with mental health, the crisis level need for resources, and Qnity's compensation findings, we quickly realized that Ally Health was an affordable and viable solution for the beauty industry. And so we're now partnering with Ally Health, and we're excited to share more with you today. And with that, I will turn it over to Jen Weaver.
Thank you so much, Mary. Thank you for having me today, and thank you all for being on. I too have some experience in the beauty industry and really fell in love with the industry many, many years ago when I was sweeping hair and folding towels for my mom's salon. She is still a hairstylist, and I'm very much involved in her business on a regular basis. But about 6 years ago, I shifted from being a business consultant in the beauty industry to the employee benefits space and have really taken off with Ally Health in the last 2.5 years to bring this out to the beauty industry. And it's been a great partnership with Qnity to help do so. So really honored to be here and to share this service with you all and how it might impact your salons, spas, and partners. So without further ado, I'll jump into a little bit about us. All right, wonderful. So again, Benefits by Qnity brings you Ally Health, virtual care for the beauty industry. So why virtual care for the beauty industry? And here's some of the top things that we've recognized, and the compensation study helped to align with a lot of this as well. One of those being is that virtual care helps support your recruitment package. So we know that businesses across the board are struggling to recruit and retain their team members, and adding benefits is crucial to that support. If 80% of the population in the job search space are looking for benefits over pay, what are we doing in the beauty industry to help elevate that and elevate our space? Virtual care also really supports reduction in absenteeism. So consider this: if you've ever been to urgent care, you know that it takes at least 2 hours of your day to go to urgent care. Even if you catch it first thing in the morning, that's still at least 2 hours where you are waiting and getting treated. And then maybe you have to go to the pharmacy afterwards and pick up the prescription and so on and so forth. Furthermore, if we put kids into the mix, there's always this scenario of the 2 a.m. sick kid, ear infection. You know it's an ear infection. The kid knows it's an ear infection. The doctors know it's an ear infection. But the only option to get treatment for that child is to go to the emergency room. So we have a screaming child, 2 a.m., emergency room, which is not only costing you sleep and wellness, which is important, but it's hundreds of dollars, anywhere from a couple hundred to many hundreds of dollars to get the care that you need just to get a prescription on board with the kid. So what virtual care does, specifically in telemedicine and with Ally Health, is allows the user to get in touch with a doctor within typically 9-minute callback time or schedule an appointment when necessary. So whether it's 7 a.m. or 2 a.m. or somewhere in the middle of the day, that individual can put a call out or a request to talk to a board certified physician and get the care that they need very quickly, get that medicine on board even faster because it's sent to a 24-hour pharmacy that's local to you. And again, keeps people at work. And we know in the service industry, missing any hours at all is a huge, can create a huge gap in the business and in redirecting clients and so forth. So really, really important. Virtual care also supports employee morale and productivity. So again, when it goes back to benefits, and the more you show that you care, the more it actually does impact, and not so tangibly necessarily, but it does impact the morale and productivity of your employees or your team or whatever that is that looks like for you. So if you show that you care by offering a way for them to get access to doctors very quickly, mental health support, or even acute care for things like legal questions, financial questions, so on and so forth, it helps them to see the value of being an employee with your business. We know also, working in the small business space and the beauty industry space, that healthcare is unaffordable. So this is a non-traditional healthcare option. This is not insurance in any capacity. It is a service, just like a gym membership. So people can get access to care, and there's no deductible, there's actually no copays to a certain point, and we'll talk about that in a bit. But it is a great way to get access to care without hundreds of dollars on an insurance premium every month. We have heard this over and over again, and Mary will speak to this in a moment, but virtual talk therapy alleviates the burden on owners or managers to counsel their employees. And I know, and I just smile because I know you're probably smiling. You're like, yes, absolutely. Either you've heard this from owners and managers that you work with, or maybe you are an owner or manager and you're like, yes, I counsel my team all the time with all sorts of stuff, all sorts of drama or whatever it might be in their life. So now the owner or manager or you has a resource to redirect your employees or your team members to go get the help they need. And also you can get the help that you need. So both of those, that's all a win-win. Telemedicine specifically can redirect employee out-of-pocket or non-emergency care finances or needs. So again, talking about that late night when you really just need to go to urgent care for something simple, but the only option is the emergency room. This is redirecting that out-of-pocket, where our telemedicine has no copays at all. It's always a zero copay service. And the mental health portion is actually a zero copay for the first 10 sessions and then $90 thereafter. So 90, which is a really deep discount as far as getting access to care. And I'll get into that more as well. Lastly, our service is available to not only the employee, but their household, meaning anybody who lives with them, and any family or dependents outside the home. So let's call it employee, boyfriend, girlfriend, significant other, maybe their kid lives there too. And then there's a dependent child who's away at college. All of those people can be covered under one plan. And last but not least, in our industry, there's full-time, there's part-time, there's 1099s, there's a variety of employment types. And this service is available to all of them because, again, it's not insurance, it is a service, and it's more so like a membership than it is anything else. So if you have full-time employees, part-time, or 1099s, this is something that can either be made available or that can be purchased ahead of time for all of your people. Mary, what else have you seen as you've been working with us in the last year or so? What's come up?
Yeah, I think I would agree with it. I guess the top three that I hear very consistently is that there's just a general concern and care by the salon owners. They're concerned about the health and well-being of their staff, their team, and those extended family members, and they want to do something for them. They know to be viewed as an attractive employer. Recruitment and retention is top on their mind, and they want to be proactive with their benefits offerings and something that is affordable for them to offer. And then it was surprising for me, just coming in from outside of the beauty industry myself, just to hear from salon owners that kind of that burden that you talked about, trying to there for everyone and kind of to share the burden of the mental health concerns and what have you. And they recognize, these owners, that they don't have the bandwidth or the expertise to do that. And so they are thrilled with the idea of offering something like Ally Health to help their employees and their family members.
Absolutely. Yeah, absolutely. And just so you all know, in the bottom right-hand corner of the screen, if you want to scan that QR code, and you'll see it on slides ongoing, there's a form that will pop up from that QR code where you can request more information about Ally Health and schedule some time with Mary to talk further about how this would work in your business specifically. So take this all in, but definitely scan that QR code and reach out. So let's talk a little bit more about mental health. Here's some stats that are absolutely staggering. And these are actually a little bit old stats. I cannot say that any of these have improved. So 25% of Americans have an untreated behavioral health condition. And I think we can all assume why, right? There's many, many barriers to get access to mental health care. One is what I just said, access, right? When, where, how do I get in touch with a therapist? Here's another one. 50% of counties in the United States have no mental health professionals. So two, maybe I know how to find a therapist, but getting access to one because there's none in the area is incredibly difficult. Many people are driving multiple hours to go be in person with a therapist and get the care that they need. And quite frankly, that's unnecessary at this point, especially with virtual services available like ours. So this brings mental health support right to your phone, your phone through an app, your phone through a phone call, or right here on a computer like we're doing today, to get access to a therapist anytime, anywhere on your schedule. This is a big one too. So number 3 is, okay, so I found a therapist, they're a couple hours away, but they're not taking new patients. The average wait time for an initial visit is actually closer to 60 days. And this has grown increasingly because of COVID and thereafter, because people are recognizing that they do need help, they're getting help, but there's still a lot of people who cannot because the wait time is so long. Not to mention that most people don't stick with the first therapist the whole time. And I think Mary can agree, I wouldn't recommend it. You have to, just like in dating, you need to find the person that fits you. And in therapy, it's a lot of the same thing, where maybe you meet one person the first time, not quite a fit, one therapist the second time, okay, a little bit better, but like, I'm kind of thinking something else. So maybe the third therapist is the one that you get continuing treatment with. And if you're waiting a month for a first visit every time, you're halfway through the year almost by the time you actually get somebody that you align with, that can help you through your needs and get the care that you need. And lastly, of course, so because of all these reasons, 2 out of 3 people with a diagnosable mental illness do not seek treatment. There's not much more I need to say about that, because we understand why that's so difficult for people to get the care that they need. So if we consider how many people that you work with in your space, whether you are working in a salon or spa directly, or maybe you have access to like a territory and you're more of like a sales rep helping other salons and spas and people in the beauty industry, 1 out of every 5 adults and 1 out of every 6 adolescents ages 6 to 17 have a mental health need or concern or condition. And if most of them are not getting the help they need, going back to the last slide, is we need to do better. So this is a massive opportunity to give people access, reduce the barriers. So it's absolutely anonymous to use. They can use it, schedule time with a therapist at 11 o'clock at night, sitting in the car after the kids go to bed, whatever that is, and get the care they need at that point. So I think Mary has a little story about how this has worked for an adolescent.
That's right. I think it was just a couple of months ago where I received a testimonial regarding a hairstylist who had was trying to get her teenage son in for therapy, and their wait time was going to be closer to 3 months. So she was thrilled to be able to get an appointment within a week for her son to see a therapist through Ally Health. And he mentioned too that he was going to be more comfortable working in a virtual space instead of going in and sitting in a physical office. So your stat about the 33-day wait time, I think is a bit old, because, or maybe not as accurate now too. And I heard the longer wait times when I was coaching pretty consistently as well.
Yep. Absolutely. And I love that he was able to get care, and that the mom was able to provide that for her son. And even taking a step back, that the salon was able to have that trickle effect and help everybody out. So adolescents 10 years of age and older have access to therapy. They do need a parent or guardian involvement in that. Not completely, like they don't need to sit side by side, but they do need to at least provide the access. And then couples counseling is available too. So it's a really great way to get the care that you need with less roadblocks, like I mentioned. So thank you, Mary.
Mm-hmm.
So what are Ally Health services altogether? We've talked about each one of them, but let's map it out real quick. So the first one that we spoke about was telemedicine. So it's getting anything that you would need to go to urgent care for. So anything from a rash to a UTI to refilling an inhaler, like things like that. It's just really simple. Cold, cough, I need a Z-Pack. That's a big one. Z-Packs are big through telemedicine. So just getting the care you need. That's anything that you don't need an x-ray for, shortness of breath, bleeding, broken bones, go to the ER, please. Anything else can really be done, at least through telemedicine initially, and use it as triage. And if they're like, hey, maybe you should actually go in and get seen, then you can do that. At least this doesn't cost you anything, and it's taking very little time to do so. Mary, do you have any testimonials in regard to the telemedicine service?
I do. A great one that just for that service provider working in the salon. I think it was a woman who is prone to sinus infections, and she went to work and was continued to slide through the day or through the morning, and knew she was coming down with a sinus infection, and was able to slip away over her lunch hour, connect with the doctor via telemedicine. That physician called in a prescription. She was able to pick up the prescription on her way home from work that day, get a couple of doses in her, and felt well enough that she could come to work the next day. So, to your point of being able to bypass the whole urgent care, because she probably wouldn't have been able to get in to see anybody that day in her doctor's office, but being able to bypass that whole scenario, and then not having to, feeling better, and also not having to lose any work time.
Awesome. Yep. I haven't gone to urgent care since I've been with Ally Health. So it's definitely been a huge help. The other pillars we have, of course, is this mental health pillar, which is true talk therapy. So this is just like you would go into a brick and mortar, sit with a therapist on their couch and talk through your needs and your challenges, etc. It is the exact same thing, but it is virtual. So as I mentioned, you can use your phone through our app. You can use a computer through our web portal, and you can talk on the phone in some cases as well to work with the same therapist ongoing and get the care you need. We have clinical social workers and psychologists that are part of the 10 zero copay therapy sessions every year. We also have psychiatry available, which there is a copay associated with that. But if you need help with medication or something more severe, like depression or anxiety, the psychiatrist can support you in that. Psychologists and social workers have about a 7-day or less time frame for an initial visit, and psychiatry is actually a little quicker. So very cool there. We also have a third pillar, and this really combines several things, and this is all for acute care or quick counseling. So it's called our Integrated EAP 2.0. And again, it's for quick care. So if you need quick access to therapy, maybe you just need to talk to somebody right now, Maybe you are not really sure that therapy is for you, but you want to test it out, dip your toe in the water. Using this integrated EAP is a great starting point for people to get access to therapy. In addition to that, they also have access to legal counselors, financial counselors, health and wellness nutrition counselors, and coaching. There is a lot of support in this integrated EAP, where really for anything else, lifestyle needs, supports, etc., people can use this counseling tool as a soundboard. If a member or an employee or someone in their household uses the integrated EAP to get acute care mental health counseling, and the counselor says, yes, I think some continuation of care would be really helpful for you. Instead of them sending an email or a link to, here's some providers, give them a call, go find somebody, and we know it takes about 60 days to get an initial visit. Instead of doing that, our integrated service actually says you have access to therapy through Ally Health. Go back into your portal or go back into the website and schedule an appointment through the mental health pillar or portal and get the care that you need within 7 business days. So again, reducing barriers is a really big part of our business. The less people have to go seek things elsewhere and they can just stay internally in the app or the portal, the easier it is for them to continue moving forward and getting the help they need. One of the major objections that I get on a regular basis is that healthcare plans have embedded telemedicine and mental health care. So if your employees or people that you talk to have a medical plan, or maybe they have a medical plan through a spouse, yes, absolutely, they can get telemedicine through there, which typically has a copay. And quite frankly, it's a little bit more resistant to get into. The telemedicine that is part of a carrier, we call them carrier plans, a healthcare plan, are typically not talked about. They're not promoted. It's not in the forefront to be used, though it is available. It is a service that's there. The other part, the mental health care, and we've already spoken to the barriers of going through insurance to use your mental health plan. Typically, there is a copay for mental health care. There's also an extended wait time if you want to get a specific therapist who is still taking insurance. And again, reduction of barriers is our prerogative. It doesn't mean you can't go this direction. We just know having a third-party service like ours really eliminates a lot of that. Last but not least, so how does this all work? How does Ally Health make an impact? So we take a lot of pride in adding value to a company by providing our service and getting people access to care. We take on the communication, the engagement, and we monitor utilization to know how people are interacting with our service and really helping you and partnering with you as the business owner. Of course, depending who I'm talking to at the particular moment, helping the business owner to really elevate that and create more increase in morale and productivity and all of those different things that we spoke about in the beginning. And we've seen this impact the beauty industry really significantly. And I know Mary has some stories to share with that as well.
I think personally that working as an account manager in the past, this is such an important support piece, and it's really encouraging to salon owners to know that they don't have to do anything, that Ally Health handles the back end of the getting people up and started with the program. And so all of that communicating in a variety of ways through emails, text messages, whatever, to make sure that people are aware of the service, getting them engaged, and again, following up with the utilization information for company sizes of 50 or more employees, I think, right? But just this is important to busy salon owners, once again, because they don't have the bandwidth to take on much else. So knowing that they've got an account manager that they can go to for support, and knowing what Ally Health does to get everybody up and running closer to the start date of the program is really important.
Yep. Absolutely. And that involvement can be a lot of different things. Mary and I have both been on launch calls with salons. If we can pop in virtually, of course, that's great. Because you all are across the nation and we are not. So, but be able to jump in or record a video ahead of time or something that we can help you with that engagement. We absolutely hope to do so. So I know one of the biggest questions as we wrap up here, one of the biggest questions is, that's all great, tons of value, awesome, thanks so much, ladies, but how much does this cost? What I can say, and it'll vary based on several different things, but for the most part, it's less than 1 cup of fancy coffee every week for each one of your employees to have access to all of this. So, and again, that'll vary based on sort of some things that you already have in place or how big your salon or your business is, so on and so forth. But that's where Mary will work through that with you and figure out what's going to be the best fit. Scan the QR code to get access to Mary. You can obviously email her here and set up some time to talk further about the strategy that would work best for your company. Or if you are a sales rep, something that could help you maybe out in your territory, we'd love to have that conversation with you as well. Mary, anything else you'd like to share with the folks?
I don't think so. I think we've covered everything, and we just thank you for your time. And please reach out to us if you have any questions or would like to learn more.